Hi, my name is Star. I'm going to be your nurse for today. Before we get started, can you tell me your name?
Santana Johnson.
Can you tell me your date of birth?
January 3rd, 97.
Can I verify that on your name band for me, please? Okay, so next what I'm going to do is I'm going to wash my hands and provide privacy. Before we get started, do you need to use the bathroom and empty your bladder?
No.
Okay, we already covered the history completed, questions such as your biographical data, source, reasons for seeking care, present health, past medical history, past health, current medications, family history, review of systems, functional assessment, and that will be all documented in paperwork, okay? Are you ready to get started?
Yeah.
Okay, so can you tell me your height?
5'6".
Can you tell me your weight?
214.
Okay, we already took your temperature and that's at 99.7 Fahrenheit. I'm just gonna take your pulse next. Okay, so I got 42 beats in 30 seconds, which is 88 beats per minute, which is in a good range. I also took the time to look at your respirations, which is 16 breaths per minute, which is also in a good range. Next thing I'm gonna do is I'm just gonna take your blood pressure on one arm. Does this arm work for you?
This works.
Okay. Okay, I stopped feeling that pulse at 120, which means I'm going to take you to 140 next. I started hearing that beat at 130. And I stopped hearing it at 7, which is in a good range. So 130 over 70. Are you in any pain?
No.
Okay, next what I'm going to do is I'm just going to inspect your face for expression and symmetry, inspect your skin color and condition. So looking at your face right now, I'm not seeing that it's dry or chapped. I'm not seeing any acne. I'm not seeing any cuts or lesions. I see that your face is symmetrical. I don't see any drooping of one side, so that looks really good. Next what I'm going to do is I'm going to inspect and palpate your scalp. So if you can remove your bonnet for me. Okay, so I'm just going to be looking at your cranium, your hair, and your scalp. Okay, so I see that your scalp is clean. Hair is a little bit dry, but that's okay. I'm not seeing any cuts or bruises. There's nothing tender in here, is there?
No.
Okay, good. Next what I'm going to do is I'm just going to test some of your facial nerves. So something that I need you to do is just look, focus on my nose, and then I just need you to follow with your eyes, okay? And then I'm just going to be using my pen light, okay? Side. Okay. Okay, so your eye seems to be moving in a symmetrical way. I'm not seeing a lazy eye, and then that was your abducens test. And then next I'm just gonna test your facial nerve. So can you smile, frown? Can you close your eyes tight? Can you raise your eyebrows? Okay, so everything's looking good so far. Next what I'm going to do is I'm gonna palpate that temporal artery. Okay, I'm gonna rate this a +1. Feels good. Next what I'm going to do is I'm gonna palpate your temporal mandibular joint, which is around in your jaw. Okay. Next what I'm going to do is I'm gonna palpate your maxillary and front sinuses. So let me know if anything starts to hurt in here. I'm not feeling any lumps or bumps in here. Does anything hurt?
No.
Okay. So that felt good. Next what I'm going to do is we're going to do the C-No eye chart. So I need you to cover your right eye. Okay, so looking at this chart, can you tell me which what line you see?
I think it's the 4th line.
Okay.
L, P, E, D.
Okay, good. Can you cover your left eye? What line can you see?
Again, that 4th line. L, P, E, D.
Okay, good. Can you look at it with both eyes?
The 3rd line.
Okay.
T and Z.
Okay, good. Next what I'm going to do is we're going to do the confrontation test. So all that's going to happen is I need you to focus on my nose, and I'm going to put some numbers up in the air, and I just need you to tell me which one you see, okay?
3, 2, 1, 1, 5.
Okay, good. Next what I'm going to do is I'm going to test your corneal light reflex. So all I need you to do is I need you to just stare ahead, and I'm going to use my pen light and I'm just going to shine it into both of your eyes about 6 feet away, and I'm just looking for any dysymmetry, okay? Okay, so I'm gonna say that this was a negative. I'm not seeing any dysymmetry in your eyes, which is good. Is everything feeling good so far?
Yeah.
Okay, so next what I'm going to do is I'm gonna do the cover test. Just gonna cover your eye, and then I'm just gonna be watching for any type of movement in your eye. Just focus on me. Okay, I'm not seeing any movement in that eye. Okay, good. Next what I'm going to do is, can you cover up one of your eyes? We're going to do the diagnostic test. I'm going to put some numbers up in the air, and then I just need you to tell me what you see, okay?
2, 1, 3.
Can you cover your other eye?
2, 1, 3.
Okay, good. Next what I'm going to do is I'm just going to inspect your eyebrows, your eyeballs, your eyelids, your eyelashes. So looking at that, I'm not. They both look similar. I'm seeing that all your hair is intact, your eyelashes look good, they don't hurt or anything like that.
No.
I'm not seeing any redness in your eyes either. Pupils look good. Okay, so next what I'm going to do is I'm going to test your pupillary light reflex. So all I'm going to do is I'm going to take my pen light and I'm going to shine the light in one eye, and I'm just going to see what your other eye does, if it constricts or dilates, okay? Okay, so both of your eyes are dilating after I shine the light in one eye. Okay, now they're dilated back. Okay, both eyes constricted when I shine the light in the other eye. Now they're back dilated, good. Next what I'm going to do is I'm just going to do the combination test. So all I need you to do again is focus on me and then just follow my pen light with your eyes. Okay, so next what I'm going to do is I'm just going to inspect your external ear. I'm looking for the alignment, skin condition, and then that auditory meatus. Okay, so looking at your eyes, I see that your ears are pierced. It doesn't hurt when I tug on it or anything like this, right? Okay, can you make this one? I see that your ears are symmetrical. I'm not seeing any cuts, bruises, or lesions, or any redness in here. It doesn't feel tender or anything in here, right? Okay, so next what I'm going to do is I'm just going to palpate your ocular and then your tegus. So here's your tegus that I'm palpating in here on both sides, and then I'm just going to palpate all around your ear, okay? And then none of this hurts, right?
No.
Okay, so next what I'm going to do is I'm just going to inspect that external nose for symmetry and lesions. Okay, so I'm not seeing any cuts or bruises or any scars on your nose, which is good. Then I'm just going to palpate your external nose. So this doesn't hurt or anything like that, right?
No.
Okay, good. Next what I'm going to do is we're going to do the patency test. So I need you to cover one nostril. Breathe in and out. Good. Can you cover your next nostril? Breathe in and out. Did any of that hurt or anything like that?
No.
Okay, so next what I'm going to do is I'm just going to inspect your nasal passages. So I'm just going to shine my light into your nose, and I'm just going to lift up a little bit. Okay, good. I'm not seeing any blockage or anything in your nose. Your nose looks a little red, which is good. It looks moist in there. I can see all your little hairs in here. That looks good. Okay, so next what I'm going to do is I'm just going to inspect your mouth. So all I need you to do is open your mouth just a little bit. Okay, so your gums look good. I'm not seeing any missing teeth. Tongue looks good. Can you stick your tongue out for me? Can you put it to the roof of your mouth? Does that hurt?
No.
Can you do side to side? Okay, good. I'm also going to be looking at your teeth. Okay, can you also say ah? Okay, so tonsils look good. I'm not seeing any swelling. Uvula looks attached, pink. I'm not seeing any cuts or bruises in your mouth or anything like that. Buccal mucosa looks good. Okay, you can close your mouth. So I already inspected your uvula, made you say ah. I already inspected the grains of your tonsil. The position of your tongue is good. So next what I'm going to do, if you could, I'm just going to inspect your neck for any symmetry, lumps, pulsation, skin color. So your skin looks even. I don't feel any lumps or bumps in here, which is good. Next what I'm going to do, skin color looks good, pulsation feels good. Next what I'm going to do is I'm going to palpate your cervical nodes, which is in here. They start to get enlarged when you feel sick, so I'm not feeling any enlargements in here. Next, what I'm going to do is I'm just going to palpate your trachea. So all that I'm going to do is going to hold you here. And then I see that it's in a good position on the midline. Okay, good. Next, what I'm going to do is I'm going to palpate your carotid pulse. Okay, so I feel your pulse on that side. And then next, I'm just going to... Okay, I feel the pulse. I'm going to rate the pulse as a 2. Next, what I'm going to do is I'm just going to also take that carotid artery. Okay, so all I need you to do is take a deep breath in, hold. Okay, you can let that breath out. Next, I need you to hold. Take a deep breath in and hold. Okay, good. And I did that bilaterally. Next, what I'm going to do is I'm just going to test the range of motion strength on your neck and shoulders. So all I need to do is I'm going to push down and raise your shoulders, and I'm going to push down and just don't let me push down, okay? Okay, good. Next, I'm going to try to move your head this way. Don't make me move it, okay? Okay. Okay, so does anything hurt in your neck or anything like that?
No.
Okay, that range of motion feels good. Next, what I'm going to do is I'm going to palpate your thyroid. So can you turn your back to me? Okay. So does any of this hurt?
No.
Okay. Good. Next, what I'm going to do is from your posterior chest, I'm just going to inspect and estimate your anterior posterior transverse diameter. So if you can move back a little bit, like over here.
Oh.
Okay, so I'm going to take take your side diameter, and then it should be half of your back, which is good. I'm just going to inspect the skin color and condition. You look like you're in a good position of breathing. Doesn't look like you're using your accessory muscles to breathe or anything like that. Doesn't look like you're taking any shallow breaths. Next, what I'm going to do is I'm going to palpate for lumps or tenderness. So, does any of this hurt?
No.
Okay, so I don't feel any tenderness and I don't feel any lumps or bumps. Next, what I'm going to do is I'm going to hold your back in, and I just need you to take a deep breath in and then out. I'm checking your symmetric expansion, and your symmetry looks good. Can you take another deep breath in and out? Okay, good. Next, what I'm going to do is I'm just going to percuss those lung fields. If you can move up a little bit and then turn this way. Okay, so I heard some dull sounds on that, which is good. Next, what I'm going to do is I'm just going to oscillate in those same places where I percussed, okay? Is everything feeling all right so far?
Yeah.
Okay, so I need you to take a deep breath in and out. 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 Okay, so I didn't hear any turbulence, any adventicular sounds in there. I didn't hear any crackling or wheezing, which is good. Next, what I'm going to do is I'm just going to assess for your kidneys tenderness. So can you move up a little bit? And I'm going to do this on both sides of your body. Okay. So does any of this hurt? No. Okay, so next I'm just going to do the same thing. Can you turn to me? I'm going to assess on your front, so I'm just going to inspect the shape. Your facial expressions look good. It doesn't look like it doesn't look like you're in pain. Do you know what today is?
Wednesday.
Okay, level of consciousness is good. Skin color looks even. Stuff like that. Condition looks good. Quality of respirations, again, it doesn't look like you're sunken over or having any or you're taking any shallow breaths. That looks really good. Okay, so next what I'm going to do is I'm just going to palpate for any lumps or bumps. Next what I'm going to do is I'm going to percuss in those same spots. Can you lift your breast up for me? Can you lift your arm up for me? Okay, good. I've heard dull sounds in that. Next what I'm going to do is I'm just going to oscillate in those same places, okay? Take a deep breath in. Deep breath in. Deep breath in. Can you raise your breast for me? Deep breath in. Deep breath in. Okay. Deep breath in. Deep breath in. Okay, good. Again, I didn't hear any adventition sounds, any crackling, or any wheezing. So next I'm just going to look at your arms bilaterally. I'm looking for any symmetry. The skin color looks even and distributed. I don't see any discoloration. I don't see any cuts or lesions or anything like that. Next what I'm going to do is I'm just going to palpate your joints. So I'm palpating in your wrists. I'm going to palpate in here. And everything in here feels good, right? Nothing feels sore or anything like that in these shoulders. Okay, good. And I did that bilaterally. Next what I'm going to do is I'm going to inspect your nail beds. They look clean. They don't look, I don't see any swelling or any redness or any type of discoloration in your nails, which is good, and I'm doing that bilaterally. Next one I'm going to do is I'm just going to palpate your temperature. Your skin feels smooth for texture. I'm just going to check for any type of tenting. This would mean that you would be dehydrated. I'm doing that on both sides. I'm not seeing any tenting or any type of turgor. And that I did that bilaterally. Next I'm going to do is bilaterally, I'm just going to check your capillary refill, which I'm going to say is under 2 seconds, which is good. I'm going to do this other hand, which is good. Next what I'm going to do is I'm just going to palpate and rate your radial pulse. Okay, I found it. I'm going to rate this a +3. This feels very strong. Did that on one hand, now I'm going to do it on this hand. Okay, again, I'm going to rate that a +3. This feels very strong. Next one I'm going to do is I'm going to palpate your epitrochlear node. So all I need you to do is put your arm up like this. Does this hurt?
No.
Okay, I'm going to do it on this side too. Okay, good. Next one I'm going to do is I'm just going to assess your range of motion. And then just palpate the upper extremities bilaterally. So can you make a fist for me? And I'm just gonna try to push down on your arm. Don't let me push down, okay? Okay, good. I'm gonna do the same thing on this side. And then can you do this for me? Everything feels good up there?
Yeah.
Okay, great. So I'm just gonna explain a breast exam. Put your hand up, you're gonna do this in the mirror. Stuff like that, all you're gonna do is with the tip of your fingers is you're going to palpate around. Stuff like this, do it in the mirror. Do this also once a month. You're looking for any type of lumps or bumps, discoloration. Check your nipple too for any type of change in the size or how it droops or if there's any type of discharge, okay? Okay, so laying down, I just need you to lie down. Okay, so in this position, I'm just going to be looking for your apical impulse, any heaves or lifts. Looking at you, I don't see any heaves or lifts, and I can't see that apical impulse. So all I'm going to do is I'm going to palpate that apical pulse. Does this hurt?
No.
Okay, so next what I'm going to do is I'm going to I'm just going to palpate across your pericardium for thrills. Okay, and next what I'm going to do is I'm just going to auscultate in a few spots, okay? So I got aortic, pulmonic, herbs, tricuspid, mitral. Next what I'm going to do is I'm just going to auscultate that apical pulse for a minute. You can lift your breast up a little bit. Okay, so I would do this for a minute. Next what I'm going to do is I'm going to auscultate in those same spots with the bell side, okay? So we got aortic, pulmonic, herbs, tricuspid, mitral. Okay, so is everything feeling good so far?
Yeah.
Okay, so next what I need you to do is I need you to roll towards me, and then I'm just going to be listening to the S3 and S4 sounds with the bell, okay? Okay, I didn't hear that S3 or S4 sound, which means that there would be a murmur. I didn't hear that. Can you lay back on your back flat? Okay, so I didn't see you make any type of painful face or anything like that, so you feel good so far, right?
Yeah.
Okay, so next what I'm going to do is I'm just going to inspect your abdominal surface. Can you lift your shirt up for me? Okay, so looking at it, I'm not seeing any cuts, bruises, or lesions, or any type of humps or bumps. Next thing I'm going to do is I'm going to auscultate your 4 quadrants. Okay, so I got your right upper quadrant, your left upper quadrant, your right lower quadrant, then your left lower quadrant. Next thing I'm going to do is I'm going to percuss in those same spots. So this is your right upper quadrant, your left upper quadrant, your right lower quadrant, and then your left lower quadrant. Next thing I'm going to do is I'm going to palpate your spleen. Did that hurt or anything like that?
No.
Okay, next thing I'm going to do is I'm going to lightly palpate in those same quadrants, and I'm just going to be looking for any type of muscle tone, okay? So this is your right upper quadrant. Muscle tone feels firm. This is your left upper quadrant. This is your right lower quadrant. This is your left lower quadrant. So your muscle tone feels firm. Nothing hurts, right?
No.
Okay, so next what I'm going to do is I'm going to palpate in those same spots, but just a little bit deeper, okay? Okay, so this is your right upper quadrant. This is your left upper quadrant. This is your right lower quadrant. Then this is your lower left quadrant. Okay, so nothing felt bad in there, right?
No.
Okay, and then the masses felt good, and then you didn't have any pain. So next what I'm going to do is I'm going to palpate your liver. Just going to be on your right side. Next, I'm going to palpate that spleen. That's going to be on your left side. Okay. Next, what I'm going to do is I'm going to palpate your femoral pulse bilaterally, which is down here. Does anything hurt?
No.
Okay, and I did that bilaterally. Next, what I'm going to do is I'm just going to point out that inguinal lymph node, which is a little bit deeper in here, one here, and one here, and I did that bilaterally. Okay, and then that's the end of the upper assessment. Thank you.
No problem.
Hi, my name is Star. I'm going to be your nurse for today. Before we get started, can you tell me your name?
Santana Johnson.
Can you tell me your date of birth?
January 3rd, 97.
Can I just verify that on your armband for me, please? Okay, so next what I'm going to do is I'm going to wash my hands, provide privacy. And before we get started, do you need to use the bathroom and empty your bladder?
No.
Okay, so we already completed the history, which includes your biographical data, source, reason for seeking care, present health, past medical history, past health, current medications, family history, review of the systems and functional assessment, which will be documented in our paperwork. Okay, are you ready to get started?
I'm ready.
Okay, so can you tell me your height?
5'6".
Can you tell me your weight?
214.
We already took your temperature, which is at 99.7 Fahrenheit. I'm just going to take your pulse. Okay, so for 30 seconds, your pulse was 43 beats, so that's 86 beats per minute, which is in a good range. I also took the time to look at your respirations, which was 17 breaths per minute, which is in a good range as well. Next what I'm going to do is I'm going to take your blood pressure. Can I use this arm?
Yeah.
Okay. Okay, just lay your arm this way. Okay, so I stopped filling that pulse at 120, which means that I'm going to take it to 140. Start hearing that beat at 120. And then I stopped hearing that beat at 120, at 70. So 120 over 70, which is really good. Are you in any pain?
No.
Okay, so first what I'm going to do is I just need you to turn around this way, and then I'm just going to get your anterior posterior transverse diameter. So I'm going to take you by the side. Should be half of your back, which is good. Next, what I'm going to do is I'm just going to inspect your skin color and position. Your position of breath looks good. I don't see you using your accessory muscles. I don't see that you're sunken in or taking any shallow breaths, which is good. Next, what I'm going to do is I'm just going to palpate for any lumps or bumps or tenderness. So I'm not feeling any lumps or bumps or tenderness. Does anything hurt?
No.
Okay, so next what I'm going to do is I'm just going to hold you in, and I just need you to take a deep breath. I'm checking your symmetric expansion and then out. Everything's looking symmetrical. Can you take another deep breath in? Good. Next what I'm going to do is I'm going to percuss those lung fields. Okay, I'm hearing some dull sounds, which is good. Okay, next what I'm going to do is I'm going to oscillate in those same places that I percuss, okay? Take a deep breath in. Hold. Deep breath in. 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 Okay, so next what I'm going to do is I'm just going to percuss and assess those kidney for any kidney tenderness, and that's going to be bilaterally. Does any of this hurt?
No.
Okay, I'm just going to do that on both sides. Okay, so I'm hearing some dull sounds, which is good. Next, I just need you to turn to me, and I'm just going to inspect your shape, configuration. Facial expression looks good. It doesn't look like you're in any pain or you're making any painful faces. Do you know what today is?
Wednesday.
Okay, level of consciousness is good. Skin color looks good. Skin looks evenly distributed. Quality of respirations, again, looks really good. Doesn't look like you're using your accessory muscles to breathe. Doesn't look like you're taking shallow breaths or you're using a lot of energy to breathe. Next, what I'm going to do is I'm just going to palpate for any lumps or bumps. Can you come a little bit closer to me? And then under here. Next, what I'm going to do is I'm going to percuss in those same spots. Can you lift your breast up? Sorry. Okay, good. Next, what I'm going to do is I'm just going to oscillate in those same places, okay? Can you take a deep breath in? Deep breath in. Deep breath in. Deep breath in. You lift your breast up. Deep breath in. Deep breath in. Up. Deep breath in. Deep breath in. Okay, good. So I didn't hear any adventicular sounds. I didn't hear any wheezing or crackling, which is good. Next, what I'm going to do is I'm just going to explain to you what a breast exam is. So if you can lift your arm up with me, follow as I go along. So all you're going to do is always have your hand up. You're going to do this once a month in the bathroom. All you're going to do is take the tips of your hands, and then you're just going to be going in a circular motion around your breast, and you're going to be feeling for any lumps or any type of bumps. You're also going to be looking for any type of discoloration. You can also go up and down. You also want to take the time to do this in the mirror to see if you can see those lumps or bumps or any type of discoloration, but also take a look at your nipples to see if there's any drooping, if the size is changing, if there's any discharge or anything like that. So lying down, I just need you to lie down, and I'm going to, I'm just going to inspect your anterior chest for your apical impulse heaves or lifts. I'm not seeing any heaves or lifts, and I cannot see your apical pulse. So next what I'm going to do is I'm just going to palpate your apical pulse, and I'm also going to palpate across your pericardium for thrills, okay? So here's your apical impulse. Next I'm going to palpate around your pericardium. Next what I want to do is I'm just going to oscillate. So we got aortic, pulmonic, herbs, tricuspid, can you lift your wrist up for me? And mitral. Good. And then I'm just going to listen in those same spots, but now with the bell, okay? So we got aortic, pulmonic, herbs, tricuspid, and then mitral. Okay, good. So everything's sounding good so far. I didn't hear any adventicular sounds. Next, what I need you to do is I just need you to roll onto your left towards me, and I'm just going to be listening to your S3 and S4, okay? Okay, so I didn't hear the S3 or S4 indicating that there would be some type of murmur or problem in there. Can you roll back onto your back for me? Okay, I didn't see you make any painful faces to that, so you're not in any pain, right?
No.
Okay, so next, can you lift up your shirt for me a little bit? I just want to inspect your abdominal surface. So I'm not seeing any cuts or bruises or any lumps or bumps. Next, what I'm going to do is I'm just going to acetate in those spots in your 4 quadrants. And then I'm going to acetate, percuss, and then I'm also going to palpate, okay?
Okay.
So this is your right upper quadrant. Okay. This is your left upper quadrant. Okay. This is your right lower quadrant. Okay. And then this is your left lower quadrant. So I'm not hearing anything in here. When's the last time that you ate?
This morning around 10:30.
Okay, so next what I'm going to do is I'm going to percuss in those same spots, okay? So this is your right upper quadrant. This is your left upper quadrant. This is your left lower your right lower quadrant. And then this is your left lower quadrant. Okay, so next what I'm going to do is I'm going to percuss location of your spleen, which is going to be on your left side here. Does anything hurt so far?
No.
Okay, so next what I'm going to do is I'm just going to lightly palpate in those 4 quadrants, and I'm just looking for muscle tone, okay? So this is your right upper quadrant. This is your left upper quadrant. This is your right lower quadrant. And then this is your left lower quadrant. So your muscle tone feels good, it feels firm. Next, what I'm going to do is I'm just going to do that same thing, but a deeper palpation. I'm just going to be looking for any type of masses. So this is your right upper quadrant. This is your left upper quadrant. This is your right lower quadrant, and then this is your left lower quadrant. So your masses, I don't feel any masses in here, or any lumps or bumps or anything like that. Next, what I'm going to do is I'm going to palpate your liver, which is on your right side. Just in here. Next, I'm going to palpate your spleen, which is on your left side, back here a little bit. Okay, does anything hurt?
No.
Okay, so next what I'm going to do is I'm just going to palpate those femoral pulses. Okay. Does anything hurt?
No.
Okay, good. Next what I'm going to do is I'm just going to point out where that inguinal lymph node is, which is deep. One right here, one right here. Next what I'm going to do is I'm just gonna inspect your skin, hair distribution. I don't see any cuts or lesions on your legs. Your legs are a little bit dry, but that's because of the eczema, right? Okay. Hair looks good, skin color looks good, your legs look symmetric. I don't see any swelling on either side, so the size is good. Next what I'm going to do is I'm going to palpate your popliteal, your posterior tibial, and then your dorsalis pedis pulse, and then that's going to be bilaterally, okay? So here's your popliteal. Okay. And then this one. Is everything feeling good so far?
Yeah.
Next, I'm going to do your posterior popliteal, which is around in your ankle. I'm going to do this bilaterally. Next, I'm going to do your dorsalis pedis, which means that I'm just going to put your toe up. Okay. Okay. Does everything feel good so far? Are you in any pain?
No.
Okay, so next one I'm going to do is I'm just going to inspect between your toes, and then I'm also going to palpate that capillary refill, okay? So in between your toes, I'm not seeing any cuts or lesions. And this doesn't hurt when I spread these apart, right?
No.
Okay, so next I'm going to check your capillary refill, which is under 2 seconds. That's on this foot. I'm doing this bilaterally. Yep, under 2 seconds on this foot too, which is good. So next what I'm going to do is I'm just going to palpate your hips, knees, ankles, and feet, and that's going to be bilaterally. So I'm going to palpate your hips in here. Does any of this hurt?
It just is uncomfortable.
Okay, I understand. And then here's your knees. Does any of this hurt?
No.
Okay, and I got your ankles. Does any of this hurt?
No.
And then your feet. Does any of this hurt? No. Okay, good. Next one I'm going to do is I'm just gonna check your range of motion and then also your strength in your hips, knees, and ankles. So all I'm gonna do is I'm gonna lift your foot. I'm gonna push against your foot, and I just need you to push down, okay? Okay, good. And up, and then push down. Okay, good. So that motion, can you pull your legs up and down, and then can you open them wide? Okay, so that range of motion is good. Next, what we're going to do is I need you to sit up for me. Okay, so your muscle tone looks good. You didn't take too much time getting up or anything like that. Next one I'm going to do is I'm just going to assess your appearance. Your body movements look good. You don't look like you're in a bad mood. You're well groomed. You're in clean clothes. Do you know what today is? Wednesday. Okay, so your level of consciousness is good. Your mobility is good. You don't need any help getting up. Didn't take you too long to get up either. And I don't see any physical deformities. For your mood, I think that you're in a really good mood. Stuff like that, you're having a good time for as much. Okay, so next what I'm going to do is I'm just going to test your sensations. So I just need you to close your eyes. And the first thing that I'm going to do is I'm going to take an object, and I just need you to tell me if it's smooth, rigid, or dull. So I'm going to take your arm first.
That's smooth.
Okay, good. And then I'm going to touch your face next.
That's a little rough.
Yeah, it's a little rough. Okay, good. So next what I'm going to do is I'm going to test your kinesthesia. So what I'm going to do is I'm just going to move your arm, and I just need your I just need you to follow with your other one, okay? Okay, and we're going to do this bilaterally. Next, I'm going to test your sternognosis. So I need you to close your eyes, and then I'm going to put an object in your hand, and then I just need you to tell me what it is, okay? So you can open your hand.
A pen.
Okay, good. And then open your other hand.
A scissor.
Okay, good. Next, I'm going to test your graphesthesia. So all I'm going to do is I'm going to open your hand, and then I'm going to write a number in it, and then I just need you to tell me what number it is, okay?
Okay. 4.
Okay, good.
6.
Okay, good.
2. 8.
Okay, good. Next, I'm just going to test your cerebral function. So I have this piece of paper, and I just need you to take your arms out. Put your arms out for me. And then I'm just going to be testing for tremors, okay? So just balance that. Okay, so I'm not seeing any shaking or any type of tremors, which is good. Next, I'm going to test your dyskinesis. So you can open your eyes. You're going to put 2 of your arms like this, 2 of your hands like this, and then all I need you to do is stack it right on top. Okay, good, good. Next, what we're going to do is if you could lay back down for me. I need you to put this heel and right it against this shin and down. And then can you do the opposite for me? Okay, so that was good. Next, I'm going to test your gait, and I just need you to stand up. And then you're just going to be walking heel to toe for me, okay? But you can only do it to them. You don't have to do it that one. Okay, ready? Go.
Jesus Christ.
Okay, good. You can sit back down. Okay, so next all I'm going to be doing is testing your tendon reflexes. I'm going to be doing this bilaterally. Okay, I felt that one. Next, I'm going to do... Try again. Ready? Feel that one?
Yeah.
Okay, good. So next, I'm going to be testing on that brachioradialis. So, here, ready? Did you feel that?
Yeah.
Okay, I'm going to do it on this side too. There it is. Ready? Feel it? Did you feel that one? Okay, so next I just need you to sit in the chair, and then I'm going to do your patellar. Did you feel that one?
Yeah.
Okay, that was good. So next what I'm going to do is I just need you to stand up, and then I'm just going to test your Romberg. So I just need you to close your eyes and stand in place. I'm gonna hold you this way, and if you start to feel dizzy, let me know. I don't see you swaying or anything like that. Okay, so next I just need you to, you can open your eyes again. I'm just gonna palpate your spine. And then I just need you to bend over. I'm just checking your range of motion, and then just checking your spine. I'm gonna palpate again. Okay, you can sit back up, and then can you twist for me like this? I just want to check your range of motion. Okay, good. And then that's the end of our lower body assessment, and we're just gonna talk about the findings, okay?
All right.